Welcome back. Today's topic is Lewybody Dementia and the fourth part of the six-part dementia series. Rather than covering all types of dementia in one video, I have divided this into 6 individual parts so you can watch the one you are interested in. Lewybody dementia is a progressive, complex and challenging condition. Diagnosing LBD can be challenging. Early LBD symptoms are often confused with similar symptoms found in other brain diseases. Lewybody dementia can occur alone or along with other brain disorders. It is a progressive disease, meaning symptoms start slowly and worsen over time. The disease lasts an average of 5 to 8 years, but can range from 2 to 20 years for some people. How quickly symptoms develop and change varies significantly from person to person, depending on overall health, age, and severity of symptoms. In the early stages of LBD, symptoms can be mild and people can function fairly normally. As the disease advances, people with LBD require more help due to a decline in thinking and movement abilities. In the later stages of the disease, they often depend entirely on others for assistance and care. Around 10% of younger people with dementia have dementia with Lewy bodies. It particularly affects the person's ability to think and move and can cause hallucinations, fluctuations in alertness and sleep disturbances, which can be extremely distressing for the person and their family. As the condition progresses, both people with dementia with Lewy body and Parkinson's disease dementia tend to have similar symptoms and will have increasing difficulty with managing everyday tasks. What causes Lewy body dementia? Lewy body dementia is caused by abnormal clumps of protein called Lewy bodies gathering inside brain cells. These Lewy bodies can build up in many parts of the brain, but particularly in the areas responsible for thought, movement, visual perception, and regulating sleep and alertness. The effects of Lewy body dementia on a person might be having recurring visual hallucinations, see things that are not there. These can be even pleasant or even upsetting. Experience disturbed sleep known as rapid eye movement or REM sleep disorder, in which people are restless and can experience intense dreams or nightmares. Or there is a possibility of a restless leg syndrome. To know more about REM sleep and restless leg syndrome, please watch my video on sleep. Let's move on. Experience sudden changes and fluctuations in alertness. People may stare blankly into space for periods, seem drowsy and lethargic, and spend a lot of time sleeping, have slowed movement and difficulty walking, experience tremors, usually in the hands whilst at rest, have problems with balance and be prone to falls, bladder and bowel problems, difficulty with swallowing. Memory is often less affected than with other types of dementia, but people may be at more risk of mood and behavior changes such as apathy, anxiety, depression, delusions, and paranoia. One type of delusion, known as Capgras syndrome, in which the person believes that a friend or relative has been replaced by an imposter, can be particularly difficult for families. Delusions are strongly held false beliefs or opinions not based on evidence. For example, a relative who is long dead is still alive. Paranoia or an extreme irrational distrust of others, such as suspicion that people are taking or hiding things. Finally, let's look at the treatment and support. Someone with Lewy body dementia needs to get an accurate diagnosis so they get the right treatment and support. Diagnosis should include gathering information on the person's symptoms, and a specific scan called a SPECT, which is single photon emission computed tomography scan, may help support a diagnosis of Lewy body dementia. People with Lewy body dementia may be offered medication and other interventions to help with their symptoms. These will not stop or reverse the course of the course of disease, but can improve the quality of life for them and their families and carers. Some of the medications used to treat Alzheimer's disease can help with the cognitive symptoms of Lewy body dementia and can help reduce distressing, hallucinations, concentration, and memory problems. These are usually most effective in early or moderate phases, but do not help everyone. Importantly, many people with Lewy body dementia are particularly sensitive to medications used to treat hallucinations, and only certain type should be used with extreme caution. Medications used for Parkinson's symptom may be helpful, but again, caution is required as they may make hallucinations worse. Other interventions focus on symptom control and include physiotherapy and counseling. If you found today's topic useful, please like, share, and subscribe. Thanks for watching.